Costs. There's nothing that causes more dentists to get anxious, not the patient, but the dentist, than dealing with costs. So here's some things you can do to have less stress around the area of costs with your patients. The first one is expectations. When I first started my practice, one of my dental assistants had worked in a practice that was much cheaper than mine, but she said they had many more complaints about costs than my practice because the patients were never told what the costs were. So telling patients the cost of things beforehand is a good way to reduce anxiety for both them and for you. So a few ways that you can do that. Many times the new patient examination in a practice is a variable cost depending on how many x-rays you do. And when you do this, first of all, the patients can get a surprise on how expensive a new patient consultation can get. And secondly, they can start saying things like, I don't want x-rays, okay, because they're worried about the cost of all the x-rays. So a great way to get around this is to have a fixed price for a new patient consultation. New patient consultations are rarely going to make you a huge profit anyway, and they are the gateway to having a patient who needs work, which is more comprehensive. And so in my practice, that first patient consultation is a fixed price. Secondly, we do not do any treatment unless they've signed a treatment plan with the costs on it. So every single patient, no matter whether it's an emergency, whether it's a single tooth extraction, if it's a large comprehensive thing, every single patient is told the costs and they sign to say that they've been told the costs before we start. And it's surprising how many patients actually forget that you told them the costs 6 months down the track when they're getting the treatment done. So I've had patients say, you didn't tell me this implant will cost so much, and then you actually showed them the piece of paper with their signature on it and they go, oh, I forgot. Thirdly, if you're anxious about talking about costs with the patient, train someone else to do it. As a dentist, the cost of their treatment is related to your treatment planning, and so you feel anxious because if it's too expensive for them, it's your fault. Okay, that's how you'll feel. So train someone else who's not involved in the treatment planning process, so a dental assistant or a therapist or a treatment coordinator, train someone else in the office to discuss costs with the patient, and you will feel much better. You'll notice that almost all surgeons do this. If you go and see an orthopedic surgeon, the surgeon himself doesn't tell you how much it will cost. The receptionist at the front does. All surgeons like this, and it's more efficient, but it's also because it separates the person who's telling them the cost from the person who's doing the treatment planning, and then you can think like a doctor and think about the treatment they need, and someone else can deal with the dollars and cents. More importantly, the patient is much more likely to tell a staff member that the treatment is too expensive than they're to tell you. And that's really important because if something is too expensive, you can change the treatment plan to reduce the cost. But if you don't know that it's too expensive, the only way you find out that the patient's not happy is they leave and then they tell all their friends that you're too expensive. Lastly, don't ever discuss really expensive stuff the first visit. Very few patients, very few customers, very few people are ready to sign or decide really expensive treatment on the first day. You don't do it with houses, you don't do it with cars, you don't do it with investments, you don't do it with anything unless you're a very small percentage of people. It's less than 1 in 8 people will decide that what they want to do immediately. The vast majority of people need 2 to 3 months to think about any significant outlay. So slow down when you discuss significant costs. The way you reduce the shock of costs is to warn people and get them to have time to get used to the cost. So the first visit, give them a range. Say, well, what we're going to do is we're going to do the basic treatment and we're going to get you healthy, and that's going to be a small fee, and your comprehensive treatment can be quite expensive. It can range from $5,000 to $50,000. It's a huge range because this is like going crazy and this is bare bones. 2 to 3 months down the track, when you finally discuss the treatment with the patient and come to a treatment plan, that's been sitting in their head for 3 months, and now they've got used to the fact that it's not going to be $2.50, which is what they want to think when they walk in the door, but it's actually going to be tens of thousands. So that reduces the shock. And at that appointment, if they want to discuss the cost with someone else, with partner or spouse or friend, the two should come together, because no one can remember anything that you said in the appointment, and the only thing that they can remember to tell someone else is the price, and then it just becomes down to price. So There's some top tips dealing with costs. Never surprise anyone. Take time and don't do anything that's not written down and signed.